Welcome to our session today. My name is Guy Ringler, and I'm a fertility specialist for California Fertility Partners. And I've been helping gay men have babies through surrogacy for almost 20 years now. My first patient was about 16, 17 years ago. And it was interesting because the sister of one of the partners was going to be their egg donor, and their neighbor was going to be their surrogate. And back then, we didn't have the wide number of agencies available today, so this was the way that they wanted to proceed with putting together their family. And it was very important then to use the sister of one of the guys because they wanted their baby to be a genetic mix of the two of them. So this was a way that they could accomplish that. So they sent the sister to come in and see me, and she was 41. And as you know, one of the most important factors affecting the success rate of IVF is the age of the woman producing the eggs, and ideally we like the egg donors to be between the ages of 20 and 28, so the age of 41 would lower the success rate. It's very important then to have this genetic connection, and she had normal ovarian testing, normal history, so we agreed to proceed, and of course, fortunately they got pregnant in the first cycle, so it was really fantastic. So, I know you mentioned that your brother and his partner.
My brother is interested in proceeding with the process, so I'm here to get some more information for him.
Right.
So I wanted to see what would the process be? How would I start? What would you recommend the first step be in the process?
The initial step is for your brother and his partner to come in for a semen analysis and some basic testing. The semen analysis is just going to confirm that we have sperm present, and it'll assess the quantity and quality of the sperm. Generally, this process takes a period of months, and so if there is an abnormality, we may have some time to start treatment to try to improve the quantity and quality of the sperm. And at the time of the initial consultation, in addition to doing the semen analysis and baseline testing, we can review the whole treatment process. So it starts with assessment, screening of the intended parents. And then I will review the options for surrogacy agencies. Surrogate mothers are women generally between the ages of 21 and 41 with history of at least one normal pregnancy and delivery. And most of the surrogacy cycles that we do, the surrogate comes through an agency. So the surrogate agency does additional recruitment, social screening, sometimes part of the medical screening of the surrogate mothers. The surrogate agency will then match an intended parent with a potential surrogate. Once that match is made, the surrogate mother comes to us to complete her medical screening. And so at the time of the medical screening, I'll very carefully review her past medical and obstetrical history to make sure there's nothing about her prior pregnancies that would make her high risk in any way. Because our goal is to try to minimize any risk in subsequent pregnancies. And our goal is to try to find the best intrauterine environment for implantation, initiation of pregnancy, and continuation of that pregnancy to a hopefully full-term normal delivery. So surrogate mother completes her medical screening. And usually around the time the surrogate mother is going through the screening process, the intended parent will identify the egg donor. Now, you have offered to be the egg donor for your brother, but if they don't have that opportunity of a known egg donor, we work with dozens of different egg donor agencies that can provide egg donor candidates for them. With egg donors, you can have an open relationship where you meet the donor, or you can be anonymous, where you see pictures, profiles, detailed family histories, but you don't personally meet the egg donor. It's whichever option is best for you and your partner and your family situation. So once the egg donor is selected, she comes to me for medical screening. And again, we want to make sure that the individual has a normal past medical history, has no infectious disease that would complicate the pregnancy, is not a carrier of any known genetic disease that would put the offspring at risk. The egg donor undergoes psychological screening to make sure she's comfortable with the process of donating her eggs and knowing that there will be children resulting from this. And I think as a sister donating for her brother, it's very important that you're very comfortable and that it's a right situation for you and your family. So once we've completed the medical screening on the egg donor, we have the medical screening on the surrogate mother. At that point, the attorneys complete the final contracts. Once we have the contracts completed, we put together the treatment calendar. And the treatment calendar, we're synchronizing the menstrual cycles between the surrogate and the egg donor because we need the surrogate's uterus to be in the receptive phase of the cycle when those embryos are ready. So we will know 4 to 6 weeks in advance of when everything is happening, when the eggs will be ready, when the embryo transfers will take place. So then we're ready to begin treatment. In the treatment process, we're stimulating the ovaries of the egg provider with daily injections of a hormone called follicle-stimulating hormone. So we use the same protocols, medications that women for the past 30 years have used during the process of in vitro fertilization. So we're overriding the natural ovarian cycle to stimulate the ovaries to make 10 to 20 eggs is always our goal. From the start of FSH injections to egg retrieval in the egg donor, it's usually about 11 or 12 days. So during that time, she's monitored with blood tests and ultrasounds every few days so that we can determine the best time to remove the eggs. The egg retrieval is a very simple outpatient procedure in which we insert a needle from the top of the vaginal wall into the ovaries under IV sedation, so there's no pain or discomfort. It takes about 15-20 minutes. We have a surgery center in our office. We have an anesthesiologist who comes in each morning with provide anesthesia. The day of egg retrieval, we'll get a fresh semen sample or thaw semen that had been frozen at an earlier date in preparation for the insemination procedure. With insemination, usually we'll use a form of assisted fertilization known as ICSI, ICSI. In the ICSI procedure, we take one normally shaped normal swimming sperm and inject it into each egg. And this provides a fertilization rate of about 75 to 80%. So now we will keep all of those fertilized eggs or embryos in culture for a total of 5 days. So the 5 days of laboratory are really important because it allows us to assess the quality and developmental potential of those embryos. So a normal healthy embryo should continually divide and develop over each 24-hour period. So the day after egg retrieval, it's a fertilized egg or 1-cell embryo. Day 2 will have begun to divide, we'll have 2 to 4 cells. By day 3, it should have 6 to 8 cells. Now, today we generally transfer for 5 days of culture. So by day 5 of culture, an embryo should be a sphere of about 100 cells. Excuse me. It's called a blastocyst. So the blastocyst stage is the stage at which an embryo implants into the uterine lining. So if an embryo is going to initiate a pregnancy, it has to reach a blastocyst. So on the 5th day of culture, we'll select the best 1 or 2 blastocysts and transfer it into the surrogate's uterus. That make sense so far? Any questions about that part? So whether we transfer 1 or 2 depends primarily on how the intended parents feel at the possibility of twins. If you want to minimize the chance of twins, now we transfer just 1 embryo. So if you transfer 2, you have a 30 to 40% incidence of twins. If you transfer 2 day 5 embryos, egg donor to a surrogate, the twinning rate's about 30 to 40%. So if you're trying to minimize the risk of twins, it's safest to just transfer a single embryo. The overall pregnancy rates are a little bit lower, but you avoid the twin complication. And the main risk of a twin pregnancy is preterm labor and delivery. Term pregnancy is 40 weeks gestation. Twins are born 1 month early at 36 weeks. At 36 weeks, twins, babies do just fine. But if there's preterm labor and delivery and they were at under 34 weeks, 31 weeks, 32 weeks, then there's a good chance they'll spend some time in the intensive care nursery which can cause increased health risk for them in the future, as well as associated increased medical costs in the process. Thanks. Do you have questions? Today you came in a little bit late.
I guess with regards to harvesting the eggs, what health risks are there for the donating woman?
For the donor? Actually, of the treatment process for the egg donor, the main risk is something called ovarian hyperstimulation syndrome. And what this is basically an exaggerated response to treatment. So our goal is to stimulate the development of 10 to 20 eggs. If a donor has a hyper response and she makes 20 to 50 eggs, her estrogen becomes markedly elevated and it can cause some fluid shifts. That's ovarian hyperstimulation syndrome. The incidence of that is about 2% for the young egg donor. And if we monitor donors carefully to help minimize that risk below the 2%. If we see that they're making too many eggs, too many follicles, we can lower the dose of medication, and we can adjust the treatment protocol to help minimize that risk. Treatment is time if she does become hyperstimulated, generally the body will expel all this excessive fluid, but the woman can feel very, very uncomfortable,
A birthing center?
miserable for several days. So that's one of the main risks. Other potential risks for the egg donor would be ovarian torsion. Whenever the ovaries are enlarged, there's a chance that they could twist on the ligaments that hold them into place, which would cut off the blood supply. The incidence of that is about 1 in 3,500, 1 in 4,000 cases, so it's very rare, fortunately. So that's a potential risk. Another potential risk would be bleeding from the ovary, requiring surgical intervention. Similar incidence, 1 in 3,500, 1 in 4,000 cases. California Fertility Partners, we've been helping build families through surrogacy for the past 20 years, and we work with some of the leading surrogacy agencies in this country, and we have a designated nursing staff to help our patients throughout the treatment process.